Today's topic is it your diet or your gut? Identifying the root cause of your digestive symptoms. And this is such a huge question. And it's maybe a little bit of a trick question because how can we really separate our diet from our gut? But it is something that I get a lot. So, what I mean is when you have food sensitivities, it's very common to think that something about the food is bothering you. But pretty much always, whether it's an allergy, a sensitivity, or an intolerance. And we can talk a little bit about what the difference is. But whatever type of food reaction you're having, it's not the food, it's something that's going on in your body that's not normal. So the short answer to this question is it's your gut. But in the meantime, while we're figuring out what's going on, or while we still have the sensitivities or intolerances, we do have to figure out what they are and avoid them so we can feel better and calm inflammation. So, first and foremost, what's the difference between allergy, a sensitivity, and an intolerance? Allergies and sensitivities are immune responses, meaning you eat a food and you get inflammation and symptoms that are directly from the inflammatory response. So in the case of an allergy, that's going to be histamine based. So we're getting inflammation through histamine being released from the immune system when we eat a food. Sensitivities are a little different because they can involve lots of different types of immune responses other than histamine. So we get different symptoms. Histamine kind of causes your classic allergy symptoms like itching and maybe swelling and redness, angry immediate symptoms, whereas sensitivities tend to cause more insidious, under the radar, non-specific, delayed, combined reactions. They result in inflammation, but it can make it hard to figure out what food's causing it because you don't have an immediate cause and effect. If I eat a food and I have a dramatic reaction, more so it ends up, okay, I have these food sensitivities and I'm chronically not feeling good, but they can be harder to pinpoint. So we'll talk about that. Then intolerances, it's digestive, it's happening in the gut. And usually it's because you're not breaking something down all the way. So that would be like lactose intolerance, where there's a sugar in the milk that you can't break down. When you can't break a sugar down, it gets into the large intestine where you have bacteria, and the bacteria has like a feast and produces a bunch of gas. And it also can change the fluid balance in the gut and can lead to different stool changes. So that's a good example of an intolerance. Another example of a food intolerance is a FODMAP intolerance. And again, it has to do with food coming into contact, and it's usually carbohydrates. Actually, intolerance is carbohydrates, different kinds of specific carbohydrates that come into contact with gut bacteria where they normally would be fully broken down. Let's just use the FODMAP example. So high FODMAP foods. If you don't know what I mean by that, those are, if there's a whole body of foods that are high in FODMAPs, which are fermentable carbohydrates. So just some examples are onions and garlic and beans and apples and pears and cauliflower and mushrooms. So these foods normally would be totally broken down in the small intestine and into their building blocks and then absorbed into the bloodstream before they would ever meet bacteria. But if you have bacterial overgrowth in the small intestine, which is common with people who have IBS, or if maybe the FODMAPs aren't broken down fully by the time they get to the large intestine, they can meet bacteria. And again, when carbohydrates meet bacteria, we get gas, we get disruption, we get lots of symptoms. We can get bloating, discomfort, and again, the fluid changes that can lead to diarrhea or constipation or cycling between the two. So that's how I would break down sensitivities, allergies, and intolerances. Now, the question is, how do you know what's going on? So maybe you notice that you have some issues with food and you know that you don't feel good after you eat, or you suspect that you have a food issue. Usually it's confusing because a lot of times, as I mentioned earlier, these foods may have a combined response, a dose-related response. So you might eat a little bit of a food on one day and be okay with it. So you might be able to have, for example, gluten once in a while and be okay, but if you eat gluten every day, you start to feel really bloated, your stomach doesn't feel good. So that can happen with sensitivities and with intolerances. more so than allergies. So it can be hard to really pinpoint it because it's not always the same reaction. Allergies are very clear cut. It's like you always get the same thing, but sensitivities and intolerances, no. One of the best ways to figure it out is, and really the gold standard is an elimination and reintroduction. And in the elimination, you're going to eliminate everything for a finite period of time. So just pick 2 weeks and you're going to be strict and you're going to eliminate all of the things you suspect. And we'll come back to how to figure out what you suspect. But you're going to eliminate all the things you suspect. And you may even err on the side of over caution, eliminate anything you suspect, even overly so, so that you can get those symptoms calmed down. Because once you get the symptoms calmed down, then you can introduce foods back in one at a time and identify which ones were causing you a problem and how to figure out what to eliminate. That's the big question with any elimination diet. It's okay, that's great, but how do I know what I suspect? I would base this on your symptoms. So if you are having symptoms like headaches, flushing, hives, nasal congestion, sinus issues, heart palpitations, and digestive symptoms, those are more histamine related. And you can have an allergy. I've talked a lot about histamine related to allergies, but you can also have histamine intolerance. Not to be confusing, but histamine is something we produce in our bodies to fight off invaders. It's part of our immune response. But when we have an allergy, our immune system mistakenly views a pollen or a food as an invader and gives that histamine response. So the histamine is supposed to kill the pathogen, but in the case of allergies, it's firing at something that normally wouldn't be dangerous and it's hurting our tissues by friendly fire. That's why we don't feel well. That's why we have symptoms. But there's also histamine naturally present in many different foods. And we have a enzyme in our gut that breaks it down normally called the DAO, diamine oxidase enzyme. And sometimes with gut issues, especially SIBO, we're not producing as much of that enzyme. So foods that are high histamine start to bother us. Whereas before we had the gut issue, we were fine because yes, there's always been histamine in these foods, but we were able to break it down like we're supposed to. So that's where the question is it the food or is it you? Is it your body that's not functioning optimally? And in the case of histamine intolerance, that's when you don't tolerate histamine in foods. There are some other reasons for histamine intolerance, but related to gut health, the one we see by far is secondary to SIBO. So SIBO is a bacterial overgrowth in your small intestine and it causes inflammation in the small intestine. So it decreases the small intestine's ability to produce this DAO enzyme temporarily. Once we clear the SIBO, then the intestine heals and tolerance of histamine in foods improves. Now, I do SIBO testing at home kits, SIBO testing for people who suspect they might have SIBO. So that's a different topic for a different day. But for this conversation, if you feel like you have histamine intolerance, you have some of those symptoms I mentioned, like the itchy kind of histamine related symptoms, skin issues, the headaches. I see lots of it with nasal congestion, sinus issues. Then those would be the high histamine foods would be the ones to trial eliminating for 2 weeks and see if that helps your symptoms. And then even if you do determine, okay, I do have histamine intolerance because I feel better when I cut out these foods, there's a spectrum to all of these things. Allergies may be aside, but this intolerances and sensitivities, there's a spectrum. So even if histamine's an issue, you do want to reintroduce the foods. You can do it very carefully, starting with small amounts to see how much you can tolerate so that you're not over restricting your diet unnecessarily. So you might be able to do okay with certain high histamine foods and not others, or a certain amount of high histamine foods. So some other ways to know what to eliminate. So that's if you have histamine related symptoms. If you have a lot of bloating, gas, diarrhea, or constipation, in that case, I would trial FODMAP elimination and reintroduction. And so that is a whole big body of foods. There are high and low FODMAP foods in every plant food group. And then even dairy has high FODMAP foods and low FODMAP foods. So everything but meats and oils. So our fruits, vegetables, legumes, nuts, seeds, whole grains, all of those food groups have some options that are high FODMAP, some that are low FODMAP. So if you would like some guidance and some really awesome tools to navigate these foods, what they are, download my IBS resource guide because there are two apps in there. One is a food search. So you can just look up any food and is it high FODMAP? Is it low FODMAP? If it's low FODMAP, how much can I have before it becomes high FODMAP? There's all those nuances. And then there's a second app in there that will allow you to scan grocery products and it'll tell you if they have any high FODMAP ingredients. So definitely download my IBS resource guide. Those would be the top two, I would say, for gut health. If you're super new to this though, and I think it would actually make sense before diving into FODMAP intolerance. If you do feel like you have the histamine intolerance symptoms, I would go that route and do a histamine elimination. And in severe cases, you can have both. But if you're brand new to this, I would try a gluten and dairy avoidance first, either one or the other, or both at the same time versus jumping into low FODMAP because sometimes people feel better just with gluten and dairy. So gluten sensitivity can give you symptoms like bloating, brain fog, joint pain, fatigue, and dairy sensitivity usually gives you like diarrhea, cramping, gas, and bloating. So I would base what you decide to eliminate on your symptoms. And then the last part of this discussion today is identifying the root cause of your symptoms. So even if you determine that you have histamine tolerance and FODMAP intolerance, you'll want to reintroduce those foods and see what you can tolerate. And hopefully, when you reintroduce the foods, you're able to pinpoint just a few that you need to avoid. Now, I have found in my practice, I've been working with GI patients for over 10 years, that in many cases you introduce foods and you notice that you're not tolerating a lot of them. Maybe you'll feel better to some extent or fully when you eliminate them, but you just have a really hard time reintroducing any of these. For example, high FODMAP foods, because whenever you do, you trigger symptoms. And if you do this process and you determine that you're super sensitive to these foods, that's when I recommend doing some functional digestive testing to figure out why. Because usually, for example, if it's FODMAP intolerance, it will be some sort of bacterial imbalance, either in your small intestine or in your large intestine. And certainly once we clear and rebalance the gut bacteria, you go back to tolerating the food. So oftentimes when I have somebody who's not doing well with the reintroduction, we do the testing, we figure out what's out of balance, we fix it. Then when they go to reintroduce the foods, they can tolerate so much more and go back to a much more normal diet. So the two tests I recommend, one would be a SIBO breath test. This is something I order for my private one-on-one clients. So you can certainly schedule a 15-minute call with me and we can talk about doing this. This is something your doctor can also order for you, your GI doctor, if you do have a practitioner that you're working with. And so 10 years ago, when I started in GI health, almost none of the gastroenterologists were ordering SIBO testing. And now they all can, and many of them do, but it's still something that they don't always think of. So they can order it for you, but you might have to ask it. So ask them for a SIBO test, or you can talk to me about me ordering one for you if we're going to work together one-on-one. Another thing that I can do with my clients, this is not something a gastroenterologist would do, would be a comprehensive digestive stool analysis. And that is a fully comprehensive stool test that tells us all about your good to bad bacteria balance. It tells us if you might have a pathogen, which is a nasty bug in your system that's disrupting things. It tells us if you're digesting foods well enough. So are they still intact and causing problems too far down the line of the digestive tract? So it gives us a lot of great information, and that's something to consider. I wouldn't necessarily start there if you're new to this. I would start with some of the basic food elimination reintroductions, see how sensitive you are and how much improvement you can see with those first steps. Those are the functional tests. But just as far as standard tests, if you have not seen a doctor about your GI issues, you'll want to get some basic testing done, get some blood work done to screen you for celiac disease, They can do breath testing for lactose intolerance and things like that. So if you've been struggling for a while and you have not seen a gastroenterologist, it may be a good idea to get checked out. And they'll also be able to rule out more serious causes. So at least you'll know, am I dealing with IBS or am I dealing with something else that maybe needs more intervention?